Well, hello there. Hello. Good day to you. Thank you for coming today for your cranial nerve examination. Now, I ken that you've had many cranial nerve examinations before, but I do not think that you will have had a cranial nerve examination just like this one. So, how are you today? Good? Sleepy? You look a wee bit peely-wally today. You look a wee bit pale. You're not feeling very well. Just tired. Right, put that down. Tired. Okay. And when was the last time that you had a cranial nerve examination? As recently as that. Okay. Well, I'm sure my cranial nerve examination will be the best one you've ever had, so not to worry. Anywho, okay, right. Now let's get moving. So I'm a wee bit out of touch with my cranial nerve exam, so I've got this very in-depth guide that we will be following today. You know it's going to be a while since coronavirus and all, so right. I'm not going to lie though, it's a wee bit like it's trying to teach a child to do a cranial nerve examination. Wash your hands. Aye, I think we all know that. Sing the happy birthday song twice while you wash your hands. Anyway, before we get started with this, do you want a wee biscuit? A wee tea? A wee cup of tea? Maybe a wee sweetie? I've got loads of sherbet lemons and whatnot. No, you're alright? You sure? If you insist. Now, I think I want to just check you over. Aye. We didn't want to give you a cranial nerve examination when you're not feeling well, so right. I'm just gonna check your heart rate first, if that's alright with you. Aye, okay. Right, just breathe normally. You don't need to do all this hyperventilation nonsense. Just breathe in and out very normally. Aye, love that. Great. Okay. Aye, so breathe in and out. Aye, like that. Okay. Aye, keep breathing. Then I stop breathing, my goodness. Just keep going. Right. Okie dokie. Now, let me just... your head's a wee bit warm. It's a wee bit warm, but it'll be alright. What I'll do, just to keep ourselves nice and proper and safe, I'll just check your blood pressure. Do you mind? No? Right, hold on. Right, here we've got it. This is the blood pressure machine. This is a very old-fashioned blood pressure cuff. I just can't be bothered using my savings to upgrade, so it does the job though, so don't worry. We'll just check that now for you. It's a little bit handsy, it's very, there's a lot of wires basically. Right, we're just going to do it on your, what hand are you? You're left-handed. Alright, okay. So we'll do this in your right arm. gonna change this around like that. Now I just need to put my wee, I can't even remember what you call this, stethoscope on. Stethoscope to listen to it. Right, 2 6. Okay. Right. Again, just relax, alright? Yeah, that was no turned in properly. Let's try that again. Well, I'm sure you'd like to know you've got some pressure there in your blood. That looks a bit normal, but I'll do it again, right? And that'll do. Oh dear, well, to be honest, I'm quite happy with how that's looking at the minute, so I'm quite happy to proceed with your cranial nerve examination today. Are you happy to go ahead? Aye, good. You're frowning a wee bit. Turn that frown upside down. That's it. There we are. We always need to have smiles in this clinic. Rightio. Alright, so hand wash. Well, we've not got a sink in here, so the best that I can do is these anti-bac up to 6 hour protection wipes. Kills 99.999% of bacteria and germs in seconds. Dermatologically tested, suitable for sensitive skin and effective against the flu virus. Right, so one for you, there you are, and one for me. My goodness. There's a lot of hand washing these days, eh? A lot of hand washing indeed. Right, okay. Right, get that all sorted. There we are. Give me that one back, thank you. Right. Hand washing has been successfully completed today. Okay. And it says step 2, wash your hands and introduce yourself to the patient and clarify their identity. Hello, my name is Dr. Murmurs. How do you do? No. What's your identity? What's your name? Alright. Okay. And what's your date of birth? Alright. Now, I need to explain the procedure to you. So basically you have 12 cranial nerves in your body and they do lots of different things in your body. And all we're going to do with this test today is figure out if every single one of them are working properly. And if they're not, well, there's nothing I can do to help you. So, would you like, or so kindly provide me with your consent to carry out this procedure today? Great. There's a little clause here that states, just to make you aware that this procedure may make you fall asleep. And And if you do fall asleep, then I'll just put a wee blanket over you and let you sleep. We all need a wee sleep now and again. So that's absolutely no bother at all if you want to fall asleep, okay? Right, now that that's out the way, we're going to start with the olfactory nerve, which is my favourite. It is all to do with your smell, that little nose of you. So, what I'm going to do, the test that I've got, is I'm going to give you some things to smell, and you need to identify them. Right? I'm expecting full marks here. Okay. I've got this bag, you see, of things, lots of different essential oils. So I need to pick out ones that I think are very easily identified smells. Right, that's that one. Right, we'll have this one. We'll have this one. Oh my goodness. Frankincense. You'll never know what that is. That's the baby Jesus essential oil. Is it not? That's what they brought to baby Jesus. I'll keep that in there. I don't imagine you were at the birth. No, so you probably won't identify that smell. Maybe that one. Get that one. I'm looking for a particular... Oh my goodness, myrrh as well. I swear myrrh was at the birth of baby Jesus. So we've got 2 baby Jesus essential oils. I don't think you'll get either. Bear with me, I probably should have done this before he came into the room. But I'll take that one. And last one. This one. Okay. So we've got 6 smells. Now, you need to pay very close attention here because I'm expecting you to get full marks. And if not, then I may have to refer you to the nasal specialist and you really want that. He's a bit smelly. But I suppose maybe that's why he's in the nasal side of medicine. Because if you're going to be smelly, go into the part of medicine where people can't smell. Right, so the first one, I'm just going to hover this up here. Like that. It is indeed lavender. Congratulations, you got 1 point. Alrighty, this one's a little bit harder. Big deep breaths in of this. How's that smelling? Aye, you're on the right lines, but you don't know the word for it. Aye, that's eucalyptus. Smells very medical. I'll give you that. 2 points. Okay. Now I'm just going to taste this one. Slightly hard. Might try this. What does this smell like? If you're not sure, you can describe it to me. Yes, it is orange. It's in fact sweet orange. So 3 out of 6. And this one should be easy. Yes, this is very easy. Yes, peppermint. Indeed, you can smell that anywhere. This one's a little bit harder. Okay, so try this. well done to use in spot treatments. Aye. Tea tree. And then finally we've got our last one here. If you get this one, you get a full house. It is indeed lemon. Well done. Right, well, I'm very impressed with you, and you should be impressed with yourself because you're not going to have to go to the smelly doctor. Now I'm going to give you 6 out of 6. So you get a star beside your olfactory nerve. Oh, now we're moving on to the optic nerve. So we can test this in 5 ways: acuity, colour, fields, reflexes, and fundoscopy. Now, I'm very sorry, but I've got to tell you now that I was a wee bit of a cheapskate and I never bought the book with the colour tests in it. And then I was going to print them off, and my printer is black and white, so that wouldn't have done anything for you. So we're just going to skip that, and what I'm going to do is I'm going to ask you, do you think you're colourblind? No. Right, so I'm going to tick that off as patient clarified. Right. Now, can you see this test? It's a wee bit far away, but I'll bring it closer. Okay. So we're going to do your acuity test with the Snellen chart. It's a very odd name for a chart, mind you, but we're going to do it. Right. So, line 1. Please just read it out for me. Line 2. Okay. Line 3. This is your 2050 line. Line 4. Line 5 for your 2030 line. Line 6 for your 2025 line. Say it again for me, from the top. Okay. What about this line? Your 2020 line. Ah, this here. Get any of them. Anything on the one below it. 2016 line. No. Alright. Not bad, not bad. Okay, I'm going to say you're probably 2025. You don't use glasses for anything, do you? Like computers or whatnot. Right, okay. Right, well, there's clearly not any problems there with your acuity. Right, we're now need to look at your visual field. So, I'm going to test your visual field in different quadrants. I'm not going to lie, the woman on this looks a bit funky. Look. She's like doing like some sort of dance, isn't she? Okay, well, looks like I'm going to have to do this dance. But you just need to identify, basically. Okay, when I change it. Cool. Point in the direction. I just think that was a bit useless, right? Tell me when you see my fingers. Okay. 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 you're going to see that I'm doing this like very easily from the direction of my arms. I mean, that's terrible. That's a terrible taste. That. Right. Well, I'm giving your visual inattention a gold star because that was pretty good. Now we need to look at the visual reflexes. So visual reflexes comprise direct and concentric reflexes. So we're going to place one hand vertically on your nose to block any light from entering the eye which is not being tested. We're going to shine a pen torch into your eye and check that both pupils on both sides constrict. We're going to test that on both sides. Hand here. I'm just gonna shine that in and out and in and out and in and out. Okay, the other one. And and in, and out. Okay. Aye, no problems there. No problems. No fundoscopy. Right. I'm just going to check into your eye with this, okay? Look up for me. Look down. Side. And side. Look up. Down. The side. Your eyes look like eyes to me, to be honest. That's all we can ask for. They're working correctly, so I'm pretty happy with that. Working correct. Alright, so our next step is to do with some different nerves. The oculomotor nerve, the trochlear nerve and the abducent nerve. So, looking at this, we're going to ask you to keep your head perfectly still, and then we're going to draw large joining H in front using the fingers, and you need to follow this with your eyes. Okay. I'm going to do that in a second. So follow my fingers. That's okay, just follow it one more time. Perfect. Did you get any tunnel vision? Tunnel vision? No, double vision. Did you have any double vision or anything like that? No, you're alright. Okay. Right, no bother. So, this one is fine. Now, step 11 is the trigeminal nerve. It's involved in sensory supply to the face and motor supply to the muscles of mastication. There are 3 sensory branches of the trigeminal nerve, which is the ophthalmic, maxillary and mandibular. So we're going to test by lightly touching the face with a piece of cotton wool, followed by a pin on each side of the face. So we're going to do around the jawline, the cheek and the forehead. Okay? Now, we're also going to do the corneal reflex, which is the corner of your eye as well. It should cause you to shut your eyelids, so try and get them open. We'll see if that's working correctly. Right. Okay, I'm now going to be touching your face. I'm going to put some gloves on. Get those bad boys on. I was trying to do without making farting noises, but nonetheless, there they come. So, right, so we're going to start with the cotton wool pod everywhere, okay? We're going to start on this cheek. Okay. You can feel that. Okay. That all looks good. I'm just going to flatten that out. I'm just going to put it in the corner of this eye. And then this eye. Okay. Very good. So they say a blunt pin, so I'm going to use this little tool device. We're just going to gently touch the edge of it around your face, okay? You can feel that. Just keep nodding. Okay, very good. Pleased with that. Okay, so your trigeminal nerve looks great. It really does. Looks fine. And then your corneal reflex was no bother at all. Right. So now we're going to look at your motor supply, because that was the sensory supply of the trigeminal nerve. So can you please clench your teeth together? Just like this. Clench. I'm just going to palpitate around this area of your face. Like so. Very, very good. No issues there. Righty-o. Done and that's okay. Now we need to also feel the masseter muscle and your temporalis. going to feel around the side of your neck here, where your masseter muscles on each side. Okay. And then your tympanalis up at your temples. Just going to gently feel them and make sure they're all contracted. Keep your teeth tightly close together like so. Great. There we are. Excellent. So that is fine. Oh, we need to do the jaw. Check. Okay. So I'm going to put my finger here on your jaw and I'm going to hit it. Okay, good. You have that reflex. Okay. So the abducens nerve, we've already tested in your eye movements. It's the same manner as the oculomotor and trochlear nerves, and there's no issue there because it affects that. Okay, so then we have the facial nerve. It supplies motor branches to the muscles of facial expression. So this nerve is tested by asking you to crease up your forehead, so raise your eyebrows like this. Close your eyes and keep them closed against resistance. Puff out your cheek and reveal their teeth. Right, so. Okay, so raise your eyebrows and close your eyes. Okay, I'm just going to try and open your eyes against resistance. Okay, I can feel that there. That's fine. So, pull out your cheeks and bite against me, trying to open your mouth, your teeth. Okay. Okay. That's fine. Happy with all your nerves and muscles there. So the next nerve is the vestibulocochlear nerve. So this provides innervation to the hearing apparatus of the ear and can be used to differentiate conductive and sensory neural hearing loss using the Rhine and Weber tests. So we're going to carry out the Weber's test and the Rhine test as well. So for the Weber's test, we're going to put the tuning fork base down in the centre of your forehead and ask if it's louder in either ear. For the Rhine test, we're going to put it on the mastoid process next to your ear at the bottom here and ask which is louder. Okay, so we're going to put it here and then beside your ear, and you need to work out what's louder. Right. We're going to start with your left ear. I'm going to put this like this. Okay. The next one is this. Which was louder? Okay, that's fine. We'll do this ear. Okay. And okay, good. Now I'm going to do this right here in the centre of your forehead, and you need to let me know if you find any ear to be louder than the other. You don't think so? I'll do it again. good. I'm just going to now do the whirl around test. And you just need to let me know when you can no longer hear it. We'll do that one more time. I don't know if you can hear, but my stomach is suddenly very hungry, which means I now want to just go and stuff my face with a packet of Hobnob biscuits, but I'll wait until after our taste is over. Right, that is fine. So we're going to look at the glossopharyngeal nerve now. So it provides sensory supply to the palate. It can be tested with the gag reflex or by touching the arches of the pharynx. Right, now, this will probably not be very fun for you, but open your mouth wide. That's it. Okay, no issues there. And then we have the vagus nerve. So it provides a motor supply to the pharynx. So asking you to speak gives good indication if it's working or not. Now you've been speaking throughout this and there's no problem with your speech. Now, I need to observe your uvula. So open your mouth and go ah. Alright, yep, that's fine. It lies centrally. Then we have the accessory nerve, which supplies motor, gives motor supply to the sternocleidomastoid muscle and the trapezius muscles. So we're going to need to get you to shrug your shoulders against resistance and turn the side of your head against more resistance. My hands on your shoulders. I want you to try and shrug against my resistance. Sit. And again. Very good. Now I want you to try and turn to your left. And I'm going to try and put this here. And again. Very good. Now try and turn to your right. What's it? Okay. Very good. Fabulous. Now the final nerve is the hypoglossal nerve. So I just need you to stick out your tongue so I can make sure there's no wasting, and no weakening of muscles. Okay. Yep. Now it looks like a healthy tongue to me. Okay. Now, if you've had a cranial nerve examination recently, you will probably know that you're absolutely fine. There's no problems with you at all whatsoever. Now, before I let you go, I do want to just check a couple of little things, a little extra. I did say this would be the best cranial nerve examination. So I'm just going to have a little look in your ears with this little device here. It's quite a wee handy device, I must say. Right, so I'm just going to have a good look in your ears. Alright, I thought. Okay. this one. Okay. You've got a lot of wax in there. So, don't worry. I've got some wax drops here. Just going to put some olive oil drops just to break it up a little bit. I noticed that in the last test you could hear fine, right? But you kind of struggled to hear the quieter soon, so I thought, I bet you they've got some wax in there. Which you do. That's fine though. So all we do is we take this and we just drip it like so in that ear. That ear. Perfect. You'll be fine. No, I didn't want to say anything when you came in, but I can see you've maybe been in a wee bit of a scrap. Last night, what were you doing? Were you doing the pub? Aye. Well, I hope you didn't do anything to somebody else, but I know you got a wee cut on your head, your head. So we're going to put some Savlon on there. We're going to clean it up before you go. If I can find well, I just dropped my entire medical kit. And of course we'll get some bandages on there. Just a wee plaster. Okay. So, clean it up first. It doesn't look like you've done an excellent job cleaning it up, so I'm not insulting your cleaning skills, no, I just think it needs a bit more cleaning. You didn't want infection, do you? No, so, right, I'm just going to, might sting a little bit because it's an alcoholic wipe. We're just going to get rid, there we are. There we are. Lovely. I can hear my wolf. I've got a wolf. And he's walking around. And he's just laid down. He's not allowed in my clinic room. Unfortunately. I did try and let him in earlier. But he decided to annoy the clients, so we weren't having that. Well, I'm going to put a wee bit of Savlon. I don't know if you know, but Savlon fixes absolutely everything. Absolutely everything. Right, so I'm just going to dip, 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 dip. Okay, that should keep it antiseptic. And then we're going to put this plaster on there as well. Lovely jubbly. I'll take this off. So, to summarise this for you today, they've got no problems at all with any of your cranial nerve examinations. You're absolutely fine, so you need to stop being hypochondriac and going and booking all these cranial nerve tests. You're fine. Maybe you're doing it because you're trying to get asleep. Maybe. Anywho, so cranial nerves, no bother. Your ears, just let that break down. The olive oil will feel a bit weird, like you go water in your ears a little bit. Aye, like you've been doing some roly-polies in the swimming pool. So, what I would get you to do is just lie on each side when you get home. battle of the Drunkens. Probably in Glasgow City Centre, no doubt. So that's all patched up now. Just keep a wee eye on it to make sure that you don't get any touch and you keep it clean, and it should be absolutely fine. Your heart rate was slightly quick, but understandable, so that was fine, and your blood pressure was on point. So, thank you very much for coming to see me today. I hope you find this very, very relaxing, and I hope to see you again very soon.